Drugs acting on the kidney and the urogenital system. Review questions. First question we have, in cases of severe generalized edema, which of the following fluid compartments is increased in volume? A. Intracellular, B. Interstitial, C. Transcellular, D. Plasma. The answer for that would be B. Interstitial, because generalized edema results from accumulation of fluid in the interstitial space. In severe edema, this compartment may nearly double in volume. Hypoalbuminemia underlies the edema arising from all the following except A. Hepatic disease, B. Congestive heart failure, C. Renal disease, D. Protein-losing enteropathy. The answer for that would be B. Congestive heart failure, because renal disease and protein-losing enteropathy result in loss of plasma proteins, and plasma protein synthesis by the liver is decreased in hepatic disease. Plasma albumin concentrations are not changed in congestive heart failure. For question number 3, we have, in the presence of renal disease, hyperkalemia may occur after the administration of A. Mannitol, B. Triamterene, C. Furosemide, D. Chlorothiazide. The answer for that would be B. Triamterene, because triamterene is a potassium-sparing diuretic that inhibits active sodium reabsorption in the distal tubule and collecting duct. Potassium retention may produce hyperkalemia in the presence of renal disease. For number 4, we have, which of the following statements concerning furosemide is not true? A. It tends to produce a metabolic alkalosis via urinary loss of hydrogen, potassium, and chloride. B. It decreases calcium reabsorption in the loop of Henle and increases urinary calcium loss. C. It may increase capacitance of pulmonary blood vessels and reduce epistaxis or nosebleed in racehorses. And D. It is less potent than agents which act at the proximal convoluted tubule. The answer would be D. Furosemide increases hydrogen, potassium, and chloride ion excretion rates, which produces a metabolic alkalosis. Loop diuretics are more potent than agents which act at the proximal tubules because compensatory mechanisms for sodium reabsorption are limited beyond the loop of Henle. For question number 5, we have, an alkaline urine and a decreased rate of aqueous humor formation in glaucoma is produced by A. Ethacranic acid, B. Dichlorphenamide, C. Mannitol, D. Triamterene. The answer would be B, because dichlorphenamide is a CA inhibitor which reduces NaH exchange in the proximal convoluted tubule, and thus HCO3 ion is excreted and the urine becomes alkaline. For number 6, we have, a veterinarian is presented with a dog exhibiting signs of diabetes insipidus, which does not respond to desmopressin. Paradoxically, urine output may decrease following treatment with A. Amiloride, B. Aminophylline, C. Chlorothiazide, D. Acetazolamide. The answer for that would be C, because the thiazide diuretics decrease urine volume in nephrogenic diabetes insipidus. The mechanism is not completely understood, but sodium depletion, increased sodium and chloride absorption in the proximal tubule, and reduced volume delivered to the distal nephron may enhance the action of ADH. This effect is not observed with other classes of diuretics. For 7, we have the high ceiling or loop diuretics such as furosemide, ethacranic acid, or bumetanide. A. Has a slow onset of action since they are bound to plasma albumin. B. Are the diuretics of choice in acute pulmonary edema. C. Is useful in treating aminoglycoside antibiotic toxicity since they increase renal excretion of this class of antimicrobials. D. Is potentiated by CA inhibitors such as acetazolamide or dichlorphenamide because they require an alkaline urine for their diuretic action. The answer for that would be B, because very useful in the rapid mobilization of edema fluid in life-threatening conditions. such as pulmonary edema. Their action is independent of urinary pH. Moving forward, we have question number 8. Excessive sodium retention and potassium excretion resulting from aldosterone secreting adrenal gland tumors may be treated with A. Furosemide, B. Chlorothiazide, C. Triamterene, D. Spironolactone. The answer would be D, because spironolactone is a competitive antagonist of aldosterone and ameliorates the effects of the hormone. Next, we have question number 9. Intravenous mannitol 5% would be indicated in all of the following clinical situations except A. Oliguria arising from traumatic shock, B. Ingestion of toxic amounts of cleaning solution containing potassium oxalate, C. Generalized edema arising from congestive heart failure, and D. Cerebral edema resulting from trauma. The answer would be C, because osmotic diuretics produce an initial increase in blood volume which can cause decompensation in patients with congestive heart failure. In addition, they are not effective in generalized edematous states because their saleretic action is weak. For question number 10, we have a diuretic which decreases calcium accretion via increased absorption in the distal tubule and is thus used to prevent calcium oxalate bladder stones is A. Hydrochlorothiazide, B. Ethacrenic acid, C. Triamterene, D. Spironolactone. The answer for that would be A, because the thiazide diuretics stimulate calcium reabsorption in the early distal tubule and reduce urinary calcium concentrations. This action may aid in preventing the formation of calcium oxalate uroliths. Loop diuretics increase calcium excretion. Spironolactone, triamterene, and urea does not affect calcium excretion. For question 11, we have hyperglycemia via inhibition of the conversion of proinsulin to insulin may occur with A. Thiazides, B. Loop diuretics, C. CA inhibitors, and D. Methylxanthines. Answer for that would be A, because thiazides may produce hyperglycemia by slowing the conversion of proinsulin to insulin. The effect is most prominent in the diabetic or pre-diabetic state. Question number 12, we have choose the anatomic site in the renal nephron where the principal action of acetazolamide occurs. A. Proximal tubule, B. Late distal tubule and collecting duct, C. Ascending lip of the loop of Henle, and D. Distal tubule early part. The answer for that would be A. Proximal tubule, because although acetazolamide acts on both the proximal and distal convoluted tubules, its effects on the proximal tubules are quantitatively most important for its diuretic actions because Ca concentrations are highest in this segment. For number 13, we have choose the anatomic site in the renal nephron where the principal action of spironolactone occurs. A. Proximal tubule, B. Late distal tubule and collecting duct, C. Ascending limb of the loop of Henle, and D. Distal tubule early part. The answer is B. Late distal tubule and collecting duct, because spironolactone, a potassium-sparing diuretic, acts as a competitive antagonist of aldosterone. The receptor for aldosterone is located in the distal convoluted tubule, and thus this is the site of action for spironolactone. So for this question, we have the same choices with that of the question 12 and 13. And the question is, choose the anatomic site in the renal nephron where the principal action of furosemide occurs. The answer for this question is C, because furosemide is a high saline diuretic and, like ethacrenic acid, it inhibits reabsorption in the ascending limb of a loop of Henle. For question 15, we have choose the anatomic site in the renal nephron where the principal action of chlorothiazide occurs. A. Hydrochlorothiazide, B. Ethacrenic acid, C. Triamterene, D. Spironolactone. The answer is D, because chlorothiazide is one of the several thiazide diuretics. The thiazides act primarily in the early part of the distal convoluted tubule to block sodium and chloride reabsorption. For question number 16, which of the following is contraindicated in patients with liver disease because of the danger of precipitating hepatic coma? A. hydrochlorothiazide, B. acetazolamide, C. triamterene, D. spironolactone. The answer for this would be B, because CA inhibitors such as acetazolamide increase urinary bicarbonate excretion and produce an alkaline urine. This eliminates the driving force for ammonia excretion into the urine to eliminate hydrogen by forming NH4, which is excreted. For question number 17, we have fluid and electrolyte imbalance leading to dehydration, muscle weakness, hypokalemia, and CNS depression may result from high or prolonged dosage with A. chlorothiazide, B. amiloride, C. furosemide, and D. theophylline. The answer for that would be C, because the toxic effects of loop diuretics such as furosemide are an extension of their therapeutic effects. Their potent diuretic action may deplete the body of water and electrolytes and lead to dehydration, hypokalemia, muscle weakness, and CNS depression if administered in high or prolonged dosage. Moving on, we have question number 18. The urinary pH might be intentionally altered as part of a therapeutic regimen to accomplish all the following except to A. prevent formation of some calculi, B. decrease irritant properties of urine, C. increase the effectiveness of certain chemotherapeutic drugs, and D. modify the pH of extracellular fluid. The answer for that question would be letter C, furosemide. The alteration of urinary pH has a negligible effect on the pH of extracellular fluid. Moving on, we have question number 19. What is the most important and abundant ECF cation? A. Sodium, B. Calcium, C. Chloride, D. Potassium. The answer is A. Sodium. As the most important and abundant ECF cation, sodium is essential for proper maintenance of membrane potentials, initiation of action potentials, and, according to strong ion difference theory, maintenance of acid-base balance. For question number 20, what is the major intracellular cation? A. Sodium, B. Calcium, C. Chloride, and D. Potassium. For that question, the answer is potassium. As the major intracellular cation, potassium concentrations inside and outside the cell are maintained by the sodium-potassium ATPase pump. For question number 21, we have formation of urine starts in the A. proximal tubule, B. late distal tubule and collecting duct, C. glomerulus, D. distal tubule early part. The answer would be C. Formation of urine starts in the glomerulus, where a portion of plasma water is filtered through fenestrated glomerular capillary endothelial cells, a basement membrane, and finally filtration slit diaphragms formed by the visceral epithelial cells that cover the basement membrane on its urinary space side. Question number 22. It is a double-walled invagination that surrounds the glomerular capillaries. A. proximal tubule, B. Bowman's space, C. glomerulus, D. distal tubule early part. The answer for that would be B. The filtrate collects in Bowman's space, a double-walled invagination that surrounds the glomerular capillaries. From Bowman's capsule, the filtered fluid passes into the proximal tubule and begins its passage through the renal tubular system. Question number 23. The primary constituent of the glomerular capillary colored osmotic pressure is blank in the plasma. A. albumin, B. calcium, C. chloride, D. potassium. The answer for that would be A. albumin. The primary constituent of the glomerular capillary coloid osmotic pressure is albumin in the plasma, and there is little colloidal osmotic pressure in normal urine produced by healthy glomeruli. The colloid osmotic pressure in the plasma is higher than the glomerular filtrate, resulting in an opposing force to filtration. Next, we have question number 24. The blank reabsorbs the majority of the sodium in the filtrate. A. proximal tubule, B. Bowman's space, C. glomerulus, D. distal tubule early part. And the answer is A. proximal tubule. The proximal convoluted tubule, PCT, reabsorbs the majority of sodium by various transporters, and water passively follows and is eventually absorbed in the peritubular capillaries by osmosis. For question number 25, we have the degree of sodium loss in the urine? A. Excretion. B. Salicylisis. C. Micturition. D. Natriuresis. The answer for that would be D. Natriuresis, because the degree of sodium loss in the urine is also referred to as natriuresis. Same choices with question number 25. The question is the degree of sodium loss in the urine in combination with chloride. The answer for that question would be B, because the degree of sodium lost in the urine or in combination with chloride is termed also as salicylisis. Question number 27. All except blank diuretics inhibit specific enzymes, transport proteins, hormone receptors, or ion channels. A. Osmotic diuretics. B. Loop diuretics. C. Aldosterone antagonists. D. Thiazide diuretics. The answer for that question would be A. Osmotic diuretics. All except osmotic diuretic inhibit specific enzymes, transport proteins, hormone receptors, or ion channels that function directly or indirectly in renal tubular sodium reabsorption. Question number 28. We have diuretic-induced depletion of circulating blood volume may lead to adverse effects such as A. Electrolyte imbalances, B. Hypovolemia, C. Dehydration, or D. All of the above. The answer would be all of the above. Diuretic-induced depletion of circulating blood volume may lead to adverse effects such as electrolyte imbalances and dehydration if therapy is not well monitored. Older animals and those with cardiac or renal disease are also at increased risk of adverse effects if diuretic-induced hypovolemia goes untreated. Question number 29. The most common indication for diuretic use is A. Electrolyte imbalances, B. Removal of tissue edema, C. Dehydration, D. Congenital heart failure. The answer would be B. Removal of tissue edema. The most common indication for diuretic use is removal of tissue edema. Understanding the physiological principles underlying edema formation depends upon an understanding of net capillary filtration. These drugs have been used sparingly in veterinary medicine as diuretics and are more commonly used for ophthalmic purposes as topical formations. A. Osmotic diuretics, B. Carbonic anhydrase inhibitors, C. Aldosterone antagonists, D. Thiazide diuretics. The answer would be B. This class of drugs was discovered as a result of the observation that sulfanilamide chemotherapeutic agents were capable of causing metabolic acidosis by inhibition of carbonic anhydrase. Question number 31. The primary indication for use of CA inhibitors is to A. Reduce arterial pressure, B. Inhibit production of acidosis, C. Production of aqueous humor, and D. Inhibit production of aqueous humor and reduce intraocular pressure. The answer is D. The primary indication for use of CA inhibitors is to inhibit production of aqueous humor and reduce intraocular pressure. For question number 32, what is given for acute cases of glaucoma in animals? A. Triamterene, B. Methazolamide, C. Atezolamide, and D. Aminophylline. The answer is C. For glaucoma, acetazolamide, methazolamide, ethazolamide, or dichlorphenamide are given orally 2 to 3 times daily. In acute cases, a single intravenous dose of acetazolamide is given, followed by an oral dosage regimen. Question number 33. Which of the following is a potassium-sparing diuretic? A. Triamterene, B. Methazolamide, C. Atezolamide, D. Aminophylline. The answer would be triamterene and amiloride inhibit active sodium reabsorption in the distal convoluted tubule and collecting duct. This reduces the net driving force for potassium secretion. They cause a small increase in sodium and chloride excretion without increasing potassium excretion. Their action is independent of aldosterone. Question number 34. Which of the following is the analog of aldosterone? A. Triamterene, B. Spironolactone, C. Acetazolamide, D. Aminophylline. The answer is B. Spironolactone is a competitive antagonist of the mineralocorticoid aldosterone. It reduces the aldosterone-mediated sodium-potassium exchange at the late distal convoluted tubule, increasing sodium loss while decreasing potassium loss. Spironolactone is most effective when circulating aldosterone levels are high. Question number 35. Acetazolamide and dichlorphenamide are absorbed A. Intramuscularly, B. Sparingly, C. Through intravenous route, and D. Orally. The answer would be D. Orally. Acetazolamide and dichlorphenamide are absorbed orally, distributed to tissues with high CA concentrations, and excreted by the kidney by active secretion and passive reabsorption. Question number 36. These are drugs that increase urinary loss of sodium ions and water. A. Cardiotonics, B. Diuretics, C. Keratolytics, and D. Fluid therapy. The answer would be B. Diuretics are drugs that increase urinary loss of sodium ions and water. By shrinking extracellular fluid volume, they mobilize edema fluid from the interstitial space and restore normal tissue perfusion and organ function. Question number 37. Furosemide and bumetanide are examples of A. Osmotic diuretics, B. Carbonic anhydrase inhibitors, C. Loop diuretics, and D. Thiazide diuretics. The answer for that would be C. Loop diuretics. Furosemide and bumetanide are structurally related to sulfonamides. Ethacrynic acid is a derivation of phenolacetic acid. All are carboxylic acids. Furosemide is the most commonly used loop diuretic in veterinary medicine. For question number 38, what is the most commonly used loop diuretic? A. Furosemide, B. Spironolactone, C. Acetazolamide, and D. Aminophylline. The answer would be A. Furosemide increases urinary calcium excretion and is used in the treatment of hypercalcemia and hypercalciuric nephropathy in dogs and cats. And furosemide is the most commonly used loop diuretic in veterinary medicine. Question number 39. Furosemide, bumetanide, and ethacrynic acid are well absorbed A. Intramuscularly, B. Sparingly, C. Through intravenous route, and D. Orally. The answer is D. Orally. These drugs are well absorbed orally because they are actively secreted into urine by the organic acid transport system of the proximal convoluted tubule and thus rapidly reach their site of action in the loop of Henle. For question number 40, which of the following is not an adverse effect of thiazide diuretics? A. Hyperglycemia, B. Hypochloremia, C. Hyperkalemia, and D. Hypokalemia. The answer is C. Hyperkalemia. The moderate diuresis produced by thiazide results in less disturbance of ECF electrolyte balance than other classes of diuretics. Hypokalemia and hypochloremia may develop with high or prolonged doses. Hyperglycemia may occur and may aggravate pre-existing diabetes mellitus. For question number 41, what should not be used in generalized edema or acute pulmonary edema? A. Furosemide, B. Mannitol, C. Acetazolamide, and D. Aminophylline. The answer would be mannitol because its celluretic effect is small and because it produces an initial expansion of the ECF, which may exacerbate the edema and may cause decompensation in patients with congestive heart failure. Question number 42. It was the first ACE inhibitor marketed and is available in oral dosage from 12.5 to 100 mg tablets and in combination with hydrochlorothiazide. A. Ramipril, B. Verapamil, C. Enalapril, D. Captopril. The answer would be Captopril. It was the first ACE inhibitor marketed and is available in oral dosage from 12.5 to 100 mg tablets and in combination with hydrochlorothiazide. Question number 43. We have losartan, telmisartan, valsartan, and irbesartan are ARBs, ACEs, diuretics, or D. Autocoids. The answer is A. ARBs. They are approved for use in humans and they are available for oral administration and are rarely being used in dogs and cats but may see increasing use in veterinary medicine. 44. These drugs decrease the metabolism of angiotensin 1 to angiotensin 2, A. ARBs, B. ECEs, C. Diuretics, D. Acadz. The answer would be B. ACEs. The action of ACE inhibitors is to decrease the metabolism of angiotensin 1 to angiotensin 2, which produces profound physiological effects as described in section renin-angiotensin-aldosterone system. Question number 45. How does digitalis therapy increase urine output in patients with heart failure? A. Direct blockade of sodium resorption in the proximal tubule. B. Competition for antidiuretic hormone receptors in the collecting duct. C. Stimulation of central thirst centers with secondary polydipsia. And D. Secondary to increased renal perfusion because of improved hemodynamics. The answer is D. Cardiac glycosides increase urine output in patients with heart failure by improving renal perfusion secondary to improved hemodynamics. Diuresis is not caused by a direct effect on the kidney. Angiotensin converting enzyme inhibitors may cause renal failure in dogs with congestive heart or heart failure through A. Afferent glomerular arteriolar constriction, B. Afferent glomerular arteriolar dilatation, C. Efferent glomerular arteriolar constriction, or D. Efferent glomerular arteriolar dilatation. The answer would be D. Angiotensin 2 causes constriction of efferent glomerular arterioles. ACE inhibitors prevent this constriction by decreasing angiotensin 2 levels, thereby reducing the glomerular filtration rate. 47. Concerning enalapril, which statement is most accurate? A. Enalapril is the active form of the drug. B. It is associated with a significant first-pass effect. C. It has more rapid onset of action than captopril. And D. It has a longer duration of action than captopril. The answer is D. It has a longer duration of action than captopril because enalapril has a slower onset of action but a longer duration of action than captopril. Once daily dosing is possible. Question number 48. All of the following angiotensin converting enzyme inhibitors are excreted mainly by the kidney except A. Captopril, B. Enalapril, C. Lisinopril, B. Benazepril. The answer would be D. Benazepril has approximately equal biliary and renal excretion. Number 49. These drugs directly inhibit angiotensin 2 binding to angiotensin receptors. A. Glycosides, B. ACEs, C. ARBs, D. Acadz. Answer is C. ARBs. The ACE inhibitors decrease angiotensin 2 formation while the ARBs directly inhibit angiotensin 2 binding to angiotensin receptors, decreasing angiotensin 2 effects including direct vasoconstriction, rapid and slow pressure responses, vasopressin and aldosterone release, sympathetic nervous system tone, enhanced release of norepinephrine, and adrenal catecholamine release. For the last question, which of following diuretics are contraindicated for patients with diabetes mellitus? A. Potassium-sparing diuretics, B. Carbonic anhydrase inhibitors, C. Loop diuretics, and D. Thiazide diuretic. The answer for that would be potassium-sparing diuretics. Hyperkalemia can occur and thus potassium diuretics are not given in combination with another and are contraindicated in hyperkalemic patients. Hyperkalemia is especially likely in the presence of diabetes mellitus, renal disease, or thromboembolic disease.